Thank you for the opportunity to participate in this webinar and the opportunity to present our research project. My name is Maria Claesson, and I'm a doctoral student working at the Academy of Health, Working Life and Welfare at the University of Boras in Sweden. I started my doctoral studies in September 2017. Before that, I graduated as a registered nurse in 1995 and obtained a specialist qualification in anesthesia in 2002 and a master's degree as a district nurse in 2011. During my career as a registered nurse, I gained broad experience in hospitals and emergency settings, focusing on primary healthcare and community home healthcare. The University of Boras is situated in western Sweden in the region called Västra Götaland. Västra Götaland has a little over 1.7 million citizens and 49 municipalities. There are 5 universities in the region, and 4 of them offer nursing education to at least bachelor levels. The University of Boras and the Faculty of Care and Science, Work Life and Social Welfare. At the Faculty of Care and Science, Work Life and Social Welfare, high quality interdisciplinary education and research are conducted in close interaction with the wider community. The research area of the current project is in the area human perspective on care. The research question focuses on patient safety, the care environment, communication and caring conversations, senior citizens, management and organization. And this background picture was taken in summer before the COVID-19 pandemic. The research project, the aim of the research project I'm in is to explore and expand our knowledge of the registered nurses' leadership close to older adults in municipal home health care environments. We examine different perspectives, such as those of older adults, their relatives, and home care assistants, to create an evidence-based foundation for further research. The project consists of 4 studies, and I will present the first study, which is a systematic literature review. Except for myself, the research team includes the following people. It's the main supervisor, Karin Josefsson. She's a professor at the Karlstad University and also of the University of Borås in Sweden. Assistant supervisor Liselott Jonasson, which is associate professor at Jönköping University in Sweden. And Cecilia Ljungblad, she's a senior lecturer at the Academy of Faculty of Care and Science, Work Life and Social Welfare at the University of Borås in Sweden. Assistant supervisor to the study I present is also Elisabeth Lindberg, which is an associate professor at University of Sweden. The first study is, that I said, a systematic literature review. And a little background. Home healthcare in Sweden and worldwide is affected by the population growth of adults aged 65 years and over. Healthcare aims to support and strengthen people's health processes. In terms of sustainability, this is challenging because an aging population correlates with health problems and increased healthcare needs. And older adults also want to stay at home and live at home as soon as they can, as long as they can. From an international perspective, there is a growing need for home health care for an upcoming aging population. Registered nurses play a key role in improving older adults' health, and elderly healthcare is included in the responsibilities and competencies of a registered nurse. Registered nurses are responsible for older adults' care by promoting health, preventing disease, restoring health, and alleviating suffering. The responsibility places high demands on, for example, competence in gerontology, geriatrics, drug management, and leadership. This also includes competence to identify older adults' life history and prevent illness, as well as reduce the consequence of illness. Registered nurses have the ability to put together several parts of a complex picture through the leadership, clinical competence, and collaborative practice. Registered nurses' leadership in municipal home healthcare is based on a clear understanding of older adults' perspective in terms of meeting their needs, their relatives, and care teams. Leadership should not be confused with management, which is a formal position that entails responsibility for operation and budgets. Leadership, in contrast, seeks to implement necessary changes by developing both a vision of the future and strategies to reach that vision. Nursing leadership involves ensuring that individual leaders possess the knowledge, skills, and capacities required to empower those around them and to harness the strength towards a collective effort. While consensus exists on the importance of nursing leadership, research on what that leadership implies, working closely with older adults in municipal home healthcare, is limited. The aim of this first study was to compile and critically evaluate international research on registered nurses' leadership close to older adults in municipal home healthcare. This study will form the basis for the subsequent studies in the research project. A systematic literature review was performed on 20th of April 2018 using Signal and PubMed databases and was conducted and reported according to PRISMA guidelines. In collaboration with an information specialist from the university at Boras, a search strategy was created between February and April 2018. In total, 536 articles were found in the chosen databases, and 488 articles did not include older adults and patient care, and 11 duplicated was excluded. Total of 37 articles were identified and were imported into Ryan QCRI, which is a web-based sorting tool for systematic literature reviews. 3 of the authors read the articles and abstracts independently of each other and sorted the articles based on the inclusion criteria into the Ryan QCRI. There was agreement to include 12 articles in the quality assessment. The quality assessment was performed by 2 of the authors according to a quality assessment tool. The 12 articles were read in full and the authors completed an assessment document separately. Finally, the 2 authors compared the assessment with each other and 9 articles were found to have met the quality criteria. The included 9 studies had all a qualitative approach with an explorative or descriptive design, except for 1 ethnographic study and 1 study with qualitative interpretive design. Analysis was conducted according to qualitative research synthesis originating from meta-ethnography, according to Howell, Major, and Savage-Baden. The synthesis of 9 articles was performed by 3 authors in 4 stages. Stage 1, first level themes were identified according to the research question and were verified by text citations in several articles. Stage number 2 was second level themes, comprised or reduced from a first level themes. This was a dynamic process that involved arranging and rearranging the themes several times until clear themes emerged. In stage number 3, patterns and associations between the second level themes were interpreted, problematized, and finally synthesized into an overall third level theme. This process was repeated until third level themes were determined. In this process, 2 themes can be seen as the same but have different content, which means that there is a need for 2 separate themes. In stage 4, an overall assessment was made of the scientific basis, and the result with 10 themes and conclusions were formulated. The results contains of 10 themes were identified to describe what registered nursing leadership implies close to older adults in municipal home healthcare. And the 10 themes are trust and control, continuous learning, competence through knowledge and ability, nursing responsibility on an organization level, applications of skills, awareness of the individual needs and wholeness, mutual support, mutual relationship, collaborating on organizational and interpersonal levels, and exposures to challenges. And here is just one example of a quote that illustrates competence through knowledge and ability. When you work as a nurse in home healthcare, you make many assumptions. We usually work by ourselves, and it's not always possible to get immediately access to a physician. Then it's nice to be prepared. I feel comfortable in front of the patient when I know that I have competence. This figure illustrates registered nurses' leadership close to older adults in municipal home healthcare to imply being a multi-artist in 10 themes. To be conclusion. Nursing leadership close to older adults in municipal home healthcare implies being multi-artist. This is a complex and challenging role involving creating learning processes, for example. Clinical implications. Nursing education must prepare registered nurses for their unique and complex leadership role as multi-artists. Municipal employers require knowledge, must be educated on what nursing leadership entails if they are to create the necessary conditions for registered nurses to meet the leadership objectives and provide safe care for older adults in need of municipal home health care. The studies there is upcoming. The second study is a study based on interviews with older adults receiving municipal home health care. The preliminary results show that older adults experience registered nurses' leadership as having their own registered nurse, which they name My Registered Nurse. We also found that older adults are competent partners working with registered nurses. This manuscript has been resubmitted, and hopefully it's being accepted in short time. In the third study, This is a study based on interviews with relatives of older adults in municipal home care. This study is, the manuscript is in progress, and hopefully it will be submitted in a few weeks. The fourth study, a study based on focus group interviews with nurses assistants working in municipal home healthcare. The focus group interviews will take place in this spring, if the corona pandemic not stopped that. This is the published review, the front side. And here is some references. And